All right, let's tackle one of the trickiest topics in pediatrics, shall we? We're about to break down the causes of cyanotic heart disease with a super simple mnemonic.
Salam and welcome to A Little Push, your 5-minute fix from medical mnemonics. Today, we are going to nail down the causes of cyanotic congenital heart disease. So, picture this. You're in the middle of your peds rotation, or maybe you're cramming for boards, and bam, a question about a blue baby pops up. You know the answer is a list of things that all start with T, but man, do they get jumbled up in your head. It happens to everyone. But don't you worry, because we've got a super simple, really powerful way to keep them all straight. We're going to lock in the 5 major causes of cyanotic heart disease using a mnemonic that is literally as easy as counting from 1 to 5. Seriously. By the end of this quick explainer, you are going to have this down cold, for sure. Okay, let's jump right in. This is our whole roadmap, all on one slide. Every single number points to a specific condition, which makes this list so easy to remember when you're under pressure. Just think, 1 great vessel, 2 vessels swapped, try for 3, 4 defects, and 5 words. Simple, right? Let's break it down piece by piece. All right, let's kick things off at the very beginning with the number 1. This is going to be our anchor for the first of the 5 T's. So, number 1, easy. It reminds us of a single, one great vessel. And that points us directly to our first T, Truncus Arteriosus. This is the one where that main embryonic trunk just doesn't divide like it's supposed to. So what's actually happening with the blood flow here? Well, with just one big vessel coming off the heart, you get a total mix of the blue blood and the red blood. It's almost always found along with a ventricular septal defect, a VSD. And, for your exams, you absolutely have to remember it's linked to DeGeorge syndrome. That's super high yield. Okay, on to number 2. 2 makes you think of a pair, or 2 things being swapped around, right? Well, that is exactly what's happening in our second condition, transposition of the great vessels. Now, this is absolutely crucial. What this defect does is create 2 completely separate closed loops. You've got deoxygenated blood just going round and round the body, and oxygenated blood going round and round the lungs. They never meet. This is, well, it's incompatible with life unless there's a connection, what we call a shunt, that lets the blood mix. And for your exams, definitely keep an eye out for that classic chest x-ray finding, the egg on a string appearance. And here is a perfect picture of one of those life-saving shunts we were just talking about. This is a patent ductus arteriosus, a PDA. It's this little connection between the aorta and the pulmonary artery, and it's what can keep these babies alive, allowing that vital blood to mix until they can get to the operating room. All right, next up is number 3. And the clue is right there in the name, try, for 3. This leads us straight to our next T, which is tricuspid atresia. So with this one, the tricuspid valve literally just doesn't form. It's absent. And that means blood has no normal way to get from the right atrium into the right ventricle. So what happens? The right ventricle becomes tiny and underdeveloped, or hypoplastic. And just like we saw before, you've got to have shunts for the baby to survive. This time, you need both an ASD and a VSD. Okay, number 4. This one might be my favorite because the name basically tells you the whole story. Tetra, that's Greek for 4, right? And it points to the 4 classic defects you see in Tetralogy of Fallot. Heads up, because this is the most common cyanotic heart defect in children, so you are absolutely 100% going to see this on your exams. Those 4 parts are classic test question. You've got pulmonary stenosis, which then causes the right ventricle to get huge. That's right ventricular hypertrophy. Then there's an aorta that sits over the VSD, and of course the VSD itself. All of that together is what gives the heart that classic boot shape on an X-ray. And finally, we're at number 5. This one's another easy one to remember. Just count the words in the name. There are 5 of them. Total anomalous pulmonary venous return, or, TAPVR for short. Okay, so think about the heart's plumbing. Normally, your pulmonary veins carry all that nice oxygen-rich blood back to the left atrium. But in TAPVR, they're plumbed into the wrong spot. They drain into the right side of the heart instead. This means an atrial septal defect, an ASD, isn't just helpful, it's absolutely essential. It's the only way for some of that oxygenated blood to get over to the left side and then out to the rest of the body.
Okay, you've made it through all 5 T's. You've seen how the mnemonic works. Now let's do a little rapid-fire quiz just to make sure all this information is really locked in. You ready for this?
First question. Just think about the number 4, that classic X-ray finding we talked about.
Yes, tetra means 4, so it's tetralogy of flow. You got it. Nice work.
All right, next one. Remember the one with the 2 separate parallel circuits?
That's it. Transposition of the great vessels. That's where the aorta and pulmonary artery are completely swapped.
Okay, last question. Which one was about that single large vessel, the one trunk that didn't divide? Yes, Truncus Arteriosus. You nailed it. See? This mnemonic really works. It's that easy. That was fantastic work. You just took a really complex topic and mastered it with a simple mnemonic you can count on one hand. So take this with you. Use it for your exams, use it on your rotations, and most importantly, keep that curiosity going. What are you going to master next? Until next time, salam.